Our health is linked to the conditions in which we are born and grow, where we work and live. These conditions, such as the quality of housing, access to healthy food, and the safety of our communities, are known as the social determinants of our health, those social barriers that prevent us from being healthy. What if your life expectancy was determined by your zip code? Well, here in the greater Boston area, there's a shocking 33-year life expectancy gap between residents in Roxbury and those in Boston's Back Bay. These inequities and avoidable differences in health and social status are at the heart of our mission at Whittier Street Health Center. Our comprehensive approach to integrated care extends beyond medical services to include behavior and specialty care, wellness programs, educational workshops, and more, allowing us to focus on the patient's overall well-being. Approximately 80% of our patients present with psychosocial issues, which impact their health. The integration of behavioral health, stress reduction, and wellness support into medical visits is critical to ensuring our patients are healthy and stay healthy.
When I came to where I was very depressed. I was over 275 pounds. I was not taking care of myself. Actually, I came to Whittier just to say, okay, I need a dentist. That's all I wanted, and was to leave. But once I walked in, I just said, okay, you know what? I am going to just see a doctor. I am going to just see the dentist. I'm going to see the eye doctor. I'm going to see everything in general.
Toda mi vida le tuve miedo al dentista. Esa fue la causa principal por la que estaba perdiendo mis dientes. Desde el momento del primer día que yo vine a Whittier me di cuenta que en la recepción me trataron con amabilidad, con profesionalismo. Por primera vez me sentí cómoda y sin miedo del dentista.
After I got out of prison, I was torn down. I wasn't in a very good state of mind. I had a problem with being around crowds or too many people. I get anxiety attack, I have PTSD. I have a lot of mental health issues that I come over here and I feel safe. I feel comfortable. I'm trying to become uninstitutionalized, and it's a difference. It's a difference, and it's been a long stride, but I'm making it.
With the increase of HIV and hepatitis C in minority communities, we have integrated infectious disease programs into primary care. These screenings are now part of our routine medical visits, and as a result, we have seen increases in health engagement and improvement in health.
22 years ago, I received a phone call from my then physician's secretary, called and told me, I'm sorry, but you're HIV positive. She hung up. I literally have no recollection of the remainder of that day. Then I had no pre-counseling, no post-counseling. No one suggested that I should talk to someone. It was just this phone call, and now you're on your own. I found Whittier Street from my medical case manager to my first triage. You know, I love this place. If it wasn't for the care and the support that personally I've received here, I don't know where I'd be right now.
In addition to addressing racial and ethnic disparities in care, we also focus on the gaps in health for at-risk populations. For example, we have focused on the health of men because of the gaps in life expectancy.
For about a year and a half, I have been coming to the men's group. We have information about diabetes, we have information about heart, cancer, everything. So it's part of not only talking about your past, your present, but then at the same time, talking about how you can better your life for tomorrow. We are really grateful to Whittier for having the men's group. I have not missed one Friday.
Our youth department supports our youth in their academic success because of the high school dropout rates, and in their health because of obesity, mental health, and trauma experienced by our youth.
Whittier creates a program Race Around Roxbury, and you get to come every Tuesday and Friday. And on Tuesday, you do a nutrition program, and on Friday, you do a workout.
It's important for young people to exercise and interact with others instead of just staying home all the time. I come here for my pediatric, I come here for my doctor, and I come for my nutrition and for personal training.
People here are very friendly and they're always willing to help. What I like most about my experience here is that I get to interact with new people and form friendships.
This is the best way to get your life on track.
Recently, we turned our focus to the minority LGBT community because we've seen huge gaps in the health of this population. And we've opened a culturally competent clinic to address these health disparities.
This has really been a new journey for Whittier Street. It's been a long time coming, but over the past year, we've really taken an initiative to offer better programming that specifically targets our LGBTQ patients.
Good morning. This is Helen, Health Ambassador at Whittier Street Health Center.
But we don't wait for our patients to come to us. We're out in the community every day, connecting our neighbors to resources, insurance coverage, providing preventative screenings and education. For us at Whittier Street Health Center, it's not just about treating our patients, it's about educating and empowering them to be proactive in their own health, helping them to retain the knowledge that they've gained and to share it within the community.
When you walk through the front door of Whittier, there's a synergy and there's an exuding of change your lifestyle, think differently, step out of the box, learn how to eat nutritionally, go to the fitness center, get your energy going, get your metabolism going. I mean, to me, it's a lifestyle. Just like you, who have overcome.
To sustain good health also takes action. Studies have shown that 50% of what keeps us healthy is lifestyle. And with the increase of obesity, for example, and the impact of obesity on other health conditions, we launched our new Wellness Institute, which includes a state-of-the-art fitness club and community garden. These are just a few of the examples of lifestyle-changing programs here at Whittier Street Health Center.
I'm a believer in self-improvement, so when they asked me to come, I come. I went to cardiology, Zumba. That Zumba class is crazy. It's just like you're at a party.
Our multicultural and multilingual staff are not only dedicated to improving health outcomes, but also to creating a welcoming and culturally appropriate environment, one in which our patients feel at home. Not only do our patients receive quality, comprehensive care, they are also treated with compassion.
It's not like you're just a patient or you just another number. You are like a family here. And the service, it's terrific, and that is not only the doctors, it's everyone, from the security right up to the president, that's Mrs. Williams. It's beautiful.
And that's why I come to Whittier.
I'm really grateful to Whittier for all what they have done for me. They literally gave me back my smile. I'm able to smile.
Thank you. Of course, they're all like friends and family in here. So I gotta say thank you to all of them, because they made me feel welcome. They don't make you feel out of place. They greet you with a smile and a handshake.